Question number 1. Which of the following is not a type of communication? Option A, non-verbal and verbal. Option B, message. Option C, stochastic. And option D, telecommunication and internet.
Correct answer is option B, message. Message is not a type of communication. It is the content that which we communicate.
Question number 2. While performing oral hygiene to an unconscious patient, which additional article should be kept in the mouth care tray? Option A, disposable spatula. Option B, laryngoscope. Option C, mouth gauge. And option D, artery forceps.
Correct answer is option C, mouth gauge. Question number 3. The thermoregulation center is located at option A, hypothalamus, option B, cerebrum, option C, pituitary, and option D, medulla. Correct answer is option A, hypothalamus. The thermoregulation center located at hypothalamus.
Question number 4. The nurse acts as an advocate when she does one of the following. Option A, she postpones the physical assessment until the client is calm. Option B, she encourages the client to express feelings. Option C, she assesses the client for injury. Option D, asks the relatives to give their consent instead of patient. Correct answer is option D, asks the relatives to give their consent instead of patient. Is an act of advocacy. Question number 5. Which safety measure will you take for a drowsy patient? Option A, keep the side rails up. Option B, keep unnecessary furniture away. And option C, keep the lights on. And option D, keep extra linen at bedside. Correct answer to the question is option A, keep the side rails up. When a patient is drowsy, side rail raising will be a safety measure. It prevents patient fall. Question number 6. Which of the following factors leads to growth in cities? Option A, industrialization. Option B, housing facilities. Option C, fertility of land. And option D, natural calamities. Correct answer is option A, industrialization. Industrialization is one of a major factor that leads to growth in cities. Question number 7. Which of the following is the best answer to practice leadership? Option A, laissez-faire. Option B, transactional leadership. Option C, democratic leadership. And option D, autocratic leadership.
Correct answer is option B, transactional leadership. Transactional leadership is the best answer to practice leadership. Question number 8. The number of pulse beat per minute is known as option A, tension, option B, rhythm, option C, rate, and option D, volume. Correct answer is option C, rate. The number of pulse beats per minute is known as rate of pulse. Question number 9. While documenting the high pulse rate of a patient, nurse must document it as option A, tachycardia, option B, arrhythmia, option C, hyperpyrexia, and option D, tachypnea. Correct answer is option A, tachycardia. Question number 10. The difference between oral and axillary temperature is option A, 1 degree Celsius, option B, 1.6 degrees Celsius, option C, 0.6 degrees Celsius, and option D, 3 degrees Celsius. Correct answer is option C, 0.6 degrees Celsius. Question number 11. Down syndrome among newborn is due to option A, chromosomal error, option B, nutritional deficiency, option C, ABO incompatibility, option D, inborn error of metabolism. Correct answer is option A, chromosomal error. Down syndrome among newborn is due to chromosomal abnormality. Question number 12. What are the signs of shock? Option A, lethargy and slow pulse rate. Option B, cold, clammy skin, unconsciousness and rapid pulse rate. Option C, rapid pulse rate and unconsciousness. And option D, sweating and forgetfulness. Correct answer is option B, cold, clammy skin, unconsciousness and rapid pulse rate. These are the signs of shock. Question number 13. Most common strain of E. coli giving rise to traveler's diarrhea is option A. Enteropathogenic, option B. Enterotoxic, option C. Enteroaggregative, and option D. Enteroinvasive. Correct answer is option B. Enterotoxic. Enterotoxic is the most common strain of E. coli bacteria that may give rise to traveler's diarrhea.
Question number 14. The strategy adopted to ensure quality nursing care by statutory body is dash. Option A. Accreditation. Option B. Re-registration. Option C. Licensure and registration. And option D. Licensure.
Correct answer is option C. Licensure and registration. The strategy adopted to ensure the quality of nursing care by statutory body is licensure and registration.
Question number 15. Skin is a part of which system in the body? Option A. Endocrine. Option B. Respiratory. Option C. Integumentary. And option D. Circulatory.
Correct answer is option C. Integumentary.
Question number 16. Which of the following statement is not true? Option A. Family is a system of relationship between parents and children. Option B. Family is a group of persons who are related to each other by religion. Option C. Family is a biological unit. Option D. Family is a group defined by social relationship. Correct answer to the question is option B. Family is a group of persons who are related to each other by religion. All other options, that is option A, option C and option D, are true about family. But option B is not true about the family. Question number 17. Which of the following gland secrete hormones to maintain normal metabolic rate of the body? Options. Option A. Thyroid gland. Option B. Adrenal gland. Option C. Pancreas. And option D. Testis. Correct answer to the question is option A. Thyroid gland. Thyroid gland secretes hormone to maintain normal metabolic rate of the body. Dear candidates, thank you for watching this video lesson. If you are new to this channel, please subscribe this channel and press bell icon all for new upcoming updates. If you like this video lesson, please share with your friends. And if you have any doubts and clarifications and suggestions, feel free to post your comments and doubts in the comment box below. Thank you once again. Wish you a good day.